Hello, everybody. Welcome back for another riveting lecture about anatomy and physiology. Our next unit is number 5. This is the skeletal system. And of course, the skeletal system involves bones and joints and tendons and ligaments and all kinds of stuff like that. But we're going to dive into some cool anatomy and physiology, or some cool physiology in this unit, and we might as well get started. Here we go. So first of all, we classify bones on the basis of their shape, and there's 5 major types: long bones, short bones, flat bones, irregular bones, and sesamoid bones. And I've given you some examples here. In the center of the diagram, you can see the femur. And the femur is probably the most easily recognized bone in the human skeletal system. It's a long bone, and long bones are really important to our discussion of bone physiology because they have lots of things going on inside of them. It's a long bone because it's obviously long, and but you don't have to be long to be a long bone. It's all a matter of scale. To the right, spinning is a flat bone, and that's the scapula. And it looks a little bit like a scalpel. It's a flat bone, and the scapula is one of the flat bones. And the flat bones are notable because they develop in a way that's different from most bones in the skeleton. They occur through something called intramembranous ossification, as opposed to endochondral ossification, and we'll learn about that just in a few minutes. But there you go. There's the scapula. You can see the head of the glomerular capsule where the head of your humerus fits in. And I guess, there's the acromial process, and there's the clavicular tubercle. And, the truth is, for every bone, every facet, every protuberance has a name, and there's all kinds of names for protuberances, like condyles or tubercles, and just as many names for deficits or fossa or cavities in the bones. And so we'll learn some of them, but that's really the venue of somebody who's studying anatomy and physiology for a living, right? If you're a PT, you'll know all the names of all the bones and all the different features. Anyway, scapula is a flat bone, femur is a long bone. Down on the lower right-hand side, this is a bone of the cranium, and that is a temporal bone. It's very irregularly shaped. And generally the cranial bones are flat bones, so the parietal bone and the frontal bone and the two parietal bones and the occipital bone are flat bones, but the temporal bone is not. It's irregular in shape, and of course included with the irregular bones would be the bones of the vertebral column. All the vertebrae are irregular bones, and then there's bones down in the sacrum. Actually, bones of like the axial skeleton or the bones that are like in the middle of your body are largely irregular bones. In the upper right, I got an X-ray of somebody's joint there, and there's a sesamoid bone. Sesamoid bone are bones that are suspended in tendons or ligaments. They're not really making a joint specifically with another bone, and that is an example of a sesamoid bone right there. It's called the patella, right? Your kneecap. Kneecap's a sesamoid bone. I'm trying to think, what's the other one? I think the hyoid is a sesamoid bone. That's a bone that's sort of suspended up underneath around your voice box. In the lower center, there's an X-ray of somebody's hands, and the bones of the wrist are actually considered short bones. So those carpals and the bones of the ankles, the tarsals, are the short bones. So that's it in a nutshell. We got long, short, flat, irregular, and sesamoid bones, and there's some examples of each one. Here's a nice way to be able to identify their distribution on the body. Up top, we've got long bones, right? So the clavicle and the humerus and the ulnus, radius, femur, tibia, fibula, all long bones, and included are the metacarpals. That is the long bones of the fingers and the phalanges. They're long bones, not short bones. To the right are the flat bones. So the coxae of the pelvis and the ribs are flat, and the nubrium, the bones of the sternum, and the bones of the cranium are flat bones. Lower left, I've got both short bones and the sesamoid bones, and so the bones of the wrist and the ankles are short bones, and the patella and I guess we're missing the highway bone, which is up around the neck, as a sesamoid bone. Far lower right is the irregular bone. So the bones of the vertebral column and the maxilla, the facial bones are the irregularly shaped bones. Okay, well, when you talk about long bones, you're going to talk about all kinds of cool structures. And long bone has a combination of both cancellous or spongy bone and compact or dense bone. And so when we look at a long bone, we have a couple terms. Remember, there are two ends of each bone, and we call these ends of the bone the epiphyses or epiphyses. And there's, of course, going to be a distal and a proximal epiphysis. Remember, when we talk about distal or proximal, we're talking about the location closest to the body. And so if you recognize that bone down there as a femur, you can see the head of the femur, that is with the ball, closest to the core of the body. That's your proximal epiphysis. And then down on the right-hand side, that's where your knee would be, and that's the distal epiphysis. And of course, the ends of the long bones and all your bones really are covered with something called articular cartilage. If you remember from histology, that articular cartilage is a specialized type of hyaline cartilage. It's really smooth and has some cool cells in there that secrete all kinds of substances. You can see that in the heads and at each of the epiphyses, we see cancellous bone, cancellous bone. You also can see there's an epiphyseal plate that sort of discriminates the epiphysis from the diaphysis. Okay, so that diaphysis is the shaft, and it's a hollow shaft, although it's extremely strong. And there are layers of tissue outside of the bone called periosteum. And that membrane outside the bone is really tough. If you ever buy bones for your dogs, cow bones, they're sort of covered with that tough stuff. Remind me to bring some in for you guys to take a look at. That's the periosteum. Inside of the long bone and the diaphysis is something called the medullary cavity, the medulla. And there's periosteum outside the bone, and there's endosteum inside that medullary cavity. There's also some marrow in that medullary cavity, and in the case of the long bone, the marrow that's in the medullary cavity is yellow marrow. Yellow marrow, I have like some white blood cells growing there and fat deposits. In fact, the older you get, the more yellow marrow you have. There's red marrow in the cancellous bone. So if we look at the cancellous bone, you can see there are all these tiny finger-like projections called trabeculae, and they are separated, or they surround these lumen or spaces called interstices. And within those interstices, you will find red marrow. And red marrow, of course, is where erythropoiesis occurs. Erythropoiesis is the production of red blood cells. You also see leukopoiesis going on here as well. So we make white blood cells and red blood cells in our marrow. And of course, one of the things that one of the first types of stem cell surgery had to do with bone marrow transplants. And so if you're unlucky enough to end up with lymphoma or leukemia, one of the treatments is to have a bone marrow transplant, and supposedly very painful. Well, here's some nice slides of compact and cancellous bone. Quite beautiful stuff. You know, the slide of bone is really easy to identify. You can see these concentric rings or lamella that make up compact bone. Looks like trees growing there, and I guess in a way it's a lot like that. And then, of course, down beneath that compact bone, I can see some of those trabeculae of the spongy bone. And so we'll saw some bones in half and take a look at that stuff up close. But before we do that, let's look at some of this anatomy, microanatomy of compact bone. So you can see that the compact bone is made up of multiple layers or lamella, and these lamella they make up concentric rings that surround something called the central or Haversian canals. So each of these circular structures is called an osteon. It's the functional unit of compact bone. And the osteons are organized around blood vessels that inhabit the central canal or Haversian canal. Now, individual osteons are joined together by perforating canals, also called the Volkmann's canals, and they run across between osteon to connect them. So we've got central canal with blood vessels, Haversian canal. This is an osteon, that's an osteon. Each of these layers are lamella, blood vessels, nerves inhabit these spaces, Volkmann's canal, Haversian canal. Love it. Over here you can see some cancellous or spongy bone, the trabeculae of the spongy bone. I'd find red marrow in here. And then when I take a closer look at these lamella, what I find is that there are little cells that reside in these spaces. That's right, bone is alive. Remember that bone is connective tissue, and sort of like the character of connective tissue is to have living cells that are sort of suspended in an inorganic matrix. In this case, the inorganic matrix is a substance called apatite or hydroxyapatite, and it's a combination of salts of calcium and phosphate. And we'll look at that later in our discussion of bone, the skeleton itself. So anyway, mature bone cells are called osteocytes. They reside in lacunae or lagoons, and individual osteocytes communicate with one another through these tiny narrow passages called the canaliculus or canaliculi. All right, so individual osteocytes are communicating with one another, and of course, blood that comes up through the Ebersian canal can perfuse these tissues, and then that perfusion of gases and nutrients and the uptake of waste passes back and forth between these cells, the osteocytes. They're the mature bone cells that actually lay down that bony matrix. I think that's it for that. Remember that that the flat bones come from a process called intramembranous ossification, and this is when the bones ossify between two layers, and that kind of makes sense. Think about a flat bone. There's going to be two membranes. That periosteum actually is the source of ossification, and so these flat bones that we talked about, those bones of the cranium, the occipital, parietal, and frontal bone, and then the little facial bones as well, and then the bones of the pelvis, specifically the coxae, not the sacrum, but the sternum. That's your breastbone, and then the ribs and the scapula. They're all flat bones. They come from intramembranous ossification. The rest of the skeleton undergoes what's called endochondral ossification. Those bones start off as hyaline, and you can see a little fetal skeleton here, and we've got that skeleton undergoing endochondral ossification all over. Remember, the fetus is not fully formed in terms of the skeleton for a while. Babies' bones are really rubbery because they're made of cartilage, but they are becoming ossified. They're getting turned to stone. Ossification means to turn to stone. So, what goes on in endochondral ossification? Well, to begin with, we have what we call primary and secondary ossification centers. The primary ossification centers begin at the epiphyses. That's at the two ends. The secondary ossification center begins in the diaphysis. All right, and what's going on here is that these cells, these chondrocytes, will eventually grow. They'll extend the length of the bone. Then they'll undergo calcification. They die, and then they're actually replaced. Those chondrocytes that make up the hyaline cartilage are actually replaced with osteocytes or bony cells. Things to remember here. We have a couple different zones. We have the zone of the reserve. There's your hyaline cartilage. We have a zone of proliferation. These guys respond to growth hormone. These guys are undergoing proliferation. That is, they're undergoing lots of mitosis and respond to growth hormone. In the zone of maturation and hypertrophy, hypertrophy means to get bigger. So they're getting bigger, and they're maturing. They're becoming mature chondrocytes, and they begin to accumulate a substance called alkaline phosphatase, which is sort of the precursor to hydroxyapatite. In the zone of calcification, those chondrocytes die, and then that tissue begins to accumulate calcium. And this is the beginning of ossification. In the zone of ossification, we have bone cells called osteoclasts and osteoblasts. They're coming from the diaphysis, and they break down the cartilage and replace it with bone. All right, so osteoclasts claw at the bone, osteoblasts lay down the bone, and we can see their action here. Up top, you can see that red osteoclast eroding, resorption, or undergoing bony resorption, and you're left with all these fibers. Down bottom, you can see a bunch of fibrous matrix that's actually got these beautiful blue osteoblasts laying down bony hydroxyapatite. Now, the osteoblasts respond to the hormone calcitonin. Hopefully that makes sense. Calcitonin sounds like what you need to make bone, and you do. Calcitonin is a hormone, and it stimulates the osteoblasts to lay down bone. And the osteoclasts, they claw away bone. They respond to a hormone called parathyroid hormone. So those are the two hormones that are involved in laying down and taking back bone, and it's a dynamic process.